This is Cable Channel 5, your local origination station serving the greater hub area.
Good evening and welcome to another edition of the Yuba City Medical Explorer. My name is Dr. Robert Peppercorn and my specialty is dermatology. I serve as host of this program. The purpose of the Medical Explorer is to take you behind the scenes of medical care practices in our local area. We have a very interesting program for you tonight as we explore the field of sports medicine. Our Channel 5 cameras will take us into the office of one of our area's most popular pediatricians, and we will watch him perform a thorough sports physical examination. We will also discuss interesting topics and controversies in the area of medicine that deals with the protection of our children and athletes as they participate in strenuous physical activities. It's a very interesting and very important subject, and I hope that you will stay with us for the next half hour. Before getting to our main topic tonight, let's take a look at the latest medical news. Could alcoholism be hereditary? A substance in the blood of drunk alcoholics is a strong lead in the search for a genetic cause of alcoholism, researchers recently reported in an issue of Lancet, a British medical journal. Drunk alcoholics produce a compound that drunk non-alcoholics do not have, according to a professor at the Harvard Medical School. The study found higher levels of an enzyme in 15 of 19 intoxicated alcoholics, but in only 1 of 22 non-alcoholics. This finding means that scientists now have a new way of studying the disease. Researchers will now need to test twins and alcoholic and non-alcoholic family members. An estimated 10 million in the United States have a drinking problem, and millions are alcoholics. Chronic liver disease and cirrhosis caused by alcohol abuse are the 8th largest cause of death in the United States. In another medical news story, a new relief for nausea may soon be available. Coca leaves, the source of cocaine, can be legitimately used to relieve nausea, vomiting, and other stomach disorders, according to researchers in Boston. They are close to developing an extract from coca leaves that can be incorporated into a tablet or a form of chewing gum. Scientists documented the medicinal value of coca leaves several years ago on a trip to Peru, where they found that widespread chewing of the leaves cured stomach ailments. The scientists said that some users report feeling alert and in a good mood after chewing the leaves, but that should not be confused with the feeling one gets from using cocaine. A recent issue of Science Digest also reports that coca leaves may be used for treating motion sickness suffered by astronauts. My final news story tonight concerns tougher warning labels for cigarettes. Ignoring the objections of the cigarette industry, the Senate Labor and Human Resources Committee voted 15-1 to require that a new, tougher health warning be printed on cigarette packages. The new warning, if passed by Congress, will read, quote, "Warning, cigarette smoking causes cancer, emphysema, and heart disease, may complicate pregnancy, and is addictive," unquote. The current warning in effect since 1970 reads, "Warning, the Surgeon General has determined that cigarette smoking is dangerous to your health." The bill passed by the Senate committee does not carry a requirement that cigarette advertising include the new warning. However, senators are expected to introduce an amendment to the bill that would include advertising. Also included in the new bill is the requirement that chemical additives and levels of tar, nicotine, and carbon monoxide in cigarette smoke be printed on the package as well. Reaction to the committee vote was positive among anti-smoking groups. As expected, however, reaction from the tobacco industry and its allies was very negative. Members of the cigarette industry fear that the new strong warning may result in product liability suits against cigarette manufacturers. Hopefully, in my opinion, a new stronger warning label on cigarettes may prevent some of the needless disease and loss of life that we see in the United States due to cigarette smoking. My health tip tonight concerns the most common skin problem in the United States. Have you ever been embarrassed by flakes of dandruff falling from your hair, or have noticed a slight redness and flakiness of the skin around your eyebrows and nose? If you have noticed these problems, you're certainly not alone. This is the problem known as seborrhea and can be easily controlled. Begin by shampooing as frequently as possible. By shampooing daily, you'll remove most of the scales and probably stop the problem. Remember that daily shampooing does not harm the hair or the scalp and will definitely relieve the annoying itch. If regular shampoos are not effective, you should visit your local pharmacy and purchase a stronger medicated product. These can be purchased without a prescription. Some popular and effective products include Sebulex and DHS with zinc shampoo. Finally, if you're unable to find relief with shampooing alone, your physician or dermatologist can prescribe very effective medications to help you control this problem. Now, on with the Medical Explorer. Recently, I was very distressed to see that a popular and extremely well-respected physician in our community was accused of improper behavior during the performance of sports screening physical examinations in his office. I personally believe that these accusations resulted from the patient's misunderstanding of what should go on during a thorough physical examination, in this case a sports physical. Tonight, one of our area's leading pediatricians will demonstrate a real sports physical examination. Hopefully, this type of demonstration can prevent future misunderstandings between patients and their doctors. Today we return to the office of Dr. Leonard Marks at the Marysville Medical Clinic. As you know, Dr. Marks was on our program several months ago discussing the topic of asthma. We received several letters from our audience describing how they liked his work on our program, and because of that, we've asked him to come back today. Dr. Marks, thank you for being with us today.
It's always a pleasure to be here, Bob.
I really appreciate it. Thank you. We're going to have Dr. Marks today discuss and demonstrate a proper sports physical examination used and requested by schools and teams for their students, for their team members, before they're able to participate. Dr. Marks, tell us exactly what you planned for us today.
Well, actually, Bob, before I get into that, I really wanted to thank you for having me do this. As you know, the local newspaper had quite a furor, as described over in the Marysville High School, because a young new physician in town tried to do a really fine sports examination on the students there. I guess what happened is a lot of the students at the school were used to a fairly roughshod examination and were surprised because all of a sudden a competent physician wanted to do a complete and thorough exam pretty much the way it should be done. What I'm going to do is I'm going to demonstrate the way a sports physical exam should be done. I'd like to mention that I did spend some time studying with Dr. Frank Garrick. He's the orthopedic surgeon in charge of the 49ers, who communicated to the audience when I was with him a new approach towards the exam. It's not being done in this area, but you'll see it's rather unique. In addition to checking the heart and lungs and other areas of the patient, we also like to check how their joints are functioning, their capability of stretching. The full examination really requires about 15 to 20 minutes, which we just don't have time for, so I'm going to highlight it today. I tried to find a teenage patient to use. However, I found that the teenagers, while they parade around in their cut-off bikinis and G-strings and sometimes topless on the beach, are very hesitant to appear in leotards on television. Therefore, my fiancée, Regina Marlowe, was more than willing to cooperate and let me do an examination on her.
Well, I really appreciate that you let her get involved in this, too. It's very nice. I just wanted to say that after reading that article in the paper, it really frustrated me that a physician would be accused of something like this for performing what's considered a thorough examination. As we train in university settings, we're trained to examine everything and not let anything slip by. And you often wonder if this physician's accused for doing a thorough examination, what actually is going on in medical offices, in some medical offices.
Well, I think in the medical offices, Bob, the examinations are probably appropriate. The problem with the school is that you have inadequate facilities, inadequate time, and one of the things that happened, to use you as an example, is a doctor would come in and say, "Hi there, Bob, how are you? Okay. Good luck in football." And that's just not adequate. That really isn't. An adequate exam doesn't have to be done every year, although schools require it. An adequate exam should be done around 9th grade, and things don't change much in kids. I think for medical legal reasons, the schools and different camps require exams to be done, but in reality, the sort of exam that I am doing only need be done once during a patient's athletic career. However, if the school requests it being done more often, which is the case, then a physician has no choice but to do a thorough exam. The bit where you just listen quickly, feel once, and then boot them on their way, to me is a form of lying, and you just can't fill out a form based on that information.
Well, I certainly agree, and I'm ready to see. So let's head over now to your examining area and actually look at your patient.
Okay. Okay. Reggie, I want to thank you for doing this. I know you're a little bit embarrassed, but what we want to do is show the audience exactly what a sports physical encompasses. We're not going to have a full amount of time to do the complete exam, but normally when a patient comes in, we request them to come in either a two-piece bathing suit or bra and panties. For the purposes of television, I know you have a leotard on. Let me have you take your gown off, please. Now, the first part of the exam, what we want to do is to check one's flexibility. So I'd like you to stand over here and facing me, and then we're going to check, just to give the audience an idea of what we do, the neck muscles. And what I want you to do is to lower the head as far as you can. Check to make sure she doesn't have a swan neck deformity all the way back. There's no limitation of motion. Good. Look all the way to your left as far as you can. Keep your shoulders straight. More. So she does have a limitation of motion here, and she'd have to do more bridging if she played football. Look a little bit more to the right. Good. Now look straight ahead. Now touch your right ear to your right shoulder, please. Good. And now go the other way. Okay, good. Okay, what we've done now is check how mobile the neck is. Theoretically, if this were a football player or a wrestler, I would indicate that she has some tightness on the right side of the neck, and that before she could participate, she had to do appropriate bridging and stretching exercises. To check the shoulders, which is important for football players, I'll look at her from behind as well as in back, as she would raise her hands all the way up like this. Out, in, out, and down. And you check the front and back to make sure it's symmetrical. Now, what we want to do is to check your legs. Turn around, and let me have you stand on your tiptoes as high as you can. Good. Notice the popping inner joints. That's good. Symmetry, no unequal muscles. Very good. Okay, down again. Now what I want you to do is to stand against the table for balance and put your leg as far back as you can with your heel flat on the floor. And see how tight or loose the quadriceps are, the thigh muscles, all the way back, further. So a little tight. She'd have to do stretching for pretty much any form of sport. She can't get the leg back as far as she can. Now, the other leg, please. Thank you. Good, good. Okay. The other thing we normally check for is also scoliosis. You know how to go for scoliosis. You just bend down and dangle everything. No, facing me, please. Okay. Bend down, dangle your head, let your head go. The back is straight. You look for a hump on the shoulders, which she doesn't have, or elevation up here, so there is no scoliosis. As I've known, dear, you're perfect. Okay, now I want you to squat all the way down so your butt touches your heels. Good. A lot of the men we check can't get all the way down because their muscles are just too tight, and that's a definite area for stretching. And just do a couple steps of a duck walk. Okay, good. Up you go. Thank you. Now, could you sit up on the table, please? The full examination of the joints is far more thorough than this. We check the fingers and the elbows, but this just gives you a general idea for what we check. The actual physical examination part, I don't think is as necessary as checking the joints. It is important to take the ophthalmoscope and to check the eyes, especially for contact sports. I think the reason the schools want these exams is for legal liability. And if a person has a retinal defect or a defect in the back of the eye, that has to be mentioned before that. So if you could just pick a spot up there and stare right at it. I'm going to check your eyes quickly. Good. And if you could check up there. Very good. The checking of the ears is really totally irrelevant for a physical exam. You want to make sure the patient can hear, and if they can follow the directions and they can hear, as long as they're not lip reading, that's not necessary. However, one should also check the mouth. You have to make sure there are no bridges, open wide. Park your gum on the side. No bridges, no false teeth. Looking in the throat and saying ah is absolutely irrelevant, because for the sports physical, you don't care what the tonsils or back of the throat look like. It's mainly dentition. The neck we've already checked, and then comes to the part where we check the lungs. Now, normally, for the physical exam, the bra will be removed, and the patient will be wearing a gown. And if you could turn around and face that wall, please.
Lay down?
No, sit up, fine. That's fine. The patient would not have a leotard on. However, Dr. Peppercorn, for the sake of decency, requested my making sure she had one. And if you could take some deep breaths, please. Good. I've listened to the back. That's complete. She has no wheezes. She has no asthma. Her lung fields are clear. And so we can get you on TV. Could you turn around this way? And now comes time I want to examine the front. And anatomically, the lungs are right over here. The breast is in the way. So I can listen to the top by having you take a deep breath. Okay, now could you just hold that breast up and out of the way, please? Thank you. Okay. I have to admit, in my office, at least every other year, I will do a full breast examination on the teenage patients. It's important. Although cancer of the breast is very rare, it should be checked for. Now, the cardiac exam has 4 basic listening areas. The blood pressure and pulse will already have been done, but you want to listen up here for the outlet valves from the heart, and here for the valves involving the heart itself. Again, you have the anatomical problem of the heart being behind the breast, and the breast will muffle the sound, so the breast is going to have to be moved out of the way. Could you raise this breast up? A little higher, please. Thank you. Okay, good. Now, let me have you lay down with your head over here. I always like to listen to the heart in 2 positions, laying down as well as sitting up, because there are different sounds. So I will listen to the heart again. Again, this is in the way. I can't listen over it, just like a bra is in the way, and you cannot listen through a bra. Hold the breast out of the way, please, Reggie. Thank you. Good. Okay, the other thing that I do is to palpate the heart, make sure I don't feel any abnormal pulsations, something called a thrill, which is an abnormal flow of blood. That's done often with the palm of the hand. Good. Okay, now to examine the abdomen, raise your bottom up, please. Thank you. Press involving the liver and the spleen. This is the spleen over here. Make sure it's not enlarged, because if it is, then trauma can injure it. It's very hard to feel kidneys, but you should press, relax. Good. And often in the full exam, but I don't have time now, you have the patient rotate in different positions. Then for the sports physical, you are supposed to check for hernias, and the only way I know of inspecting for a hernia is you lower the panties, and these shorts are the panties. Raise up all the way, please. And you have to feel down here in the area. Doesn't have any hernia. Then the other thing which you should do to be thorough is you want to inspect the external vaginal area to make sure that there aren't any ulcerations, discharges, or anything which other people can get from contact sports. In men, you do have to feel in the scrotum and check the testicles and make sure there's no hernia and examine the head of the penis. And the only way I know of doing that is raise your bottom all the way. And if you could spread your legs just a little bit. and you actually will take your thumbs or your fingers and spread the labial area a little bit and check in the vaginal area. A full exam will involve spreading and inspection of the clitoral area as well. Whether the inspection of the clitoral area is totally necessary for a sports physical, quite honestly, I doubt. But it is necessary for a thorough physical examination. Okay, let's pull these up. You know, the one thing that I'd like to mention is, ideally when you do this, you're going to have a chaperone in a room. I've been involved in several situations where I've had to do sports physicals for colleges when I was in the Army and in med school, things like this. And you don't have the staff, you don't have the time, you don't have the capability. In addition, you assume that the patients that you're dealing with are athletes, they've had these things done before, and they're mature teenage-adults. I've done the exam several times where I've had chaperones behind screens where they could hear things. I really think what went on at Marysville High, from what I can gather, is blown totally out of proportion. With a nurse and a wife behind a screen, although not ideal, there's so much work to be done that I think it really was acceptable.
Dr. Marks did an excellent job showing us the intricacies and thoroughness of a proper sports physical examination.